It is exactly 9:45 a.m. and I do hope you can hear me because I've heard something very funny in the background. Okay, it is 9:45 news and views with me, Julie Ali, and something real exciting is happening at Wits University. Undoubtedly, a feather in our cap, and very especially, uh, I will go as far as saying a feather in the cap of the Muslim community, even though this app that I'm going to unpack with my guest on the show is obviously for all people right across the globe, but in this instance, particularly in South Africa, a feather in the cap of the Muslim community because it's two Muslim sisters that were involved in this initiative. Now, we understand that Wits researchers awarded 100,000 rands to develop the depression screening app for the South African context. And involved in this is obviously, like I said, two Muslim sisters, and I'm so proud of them. The first one being research psychologist and sessional lecturer at Wits University, Tasneem Hassem, and I understand the second person is Professor Sumaya Lahir. But online, we'll be talking with Tasneem Hassem. Assalamu alaikum, welcome to the program, and many congratulations to you and the team.
Walaikum assalam. Shukran for having us and Jazakallah for those kind words.
Oh, we're so proud of you. Imagine Muslim sisters that have come up with this, that are involved in this research. And may you guys grow from strength to strength. So, Sumaya, I understand the tool developed by yourself and the co-founder, Professor Sumaya Lahir. Sorry, you are Tasneem and the Professor Sumaya Lahir. You guys were chosen out of 8 other pitches in the prospector at Wits course run by Wits Enterprise. How long was this in the planning phase, or that first phase of will this be workable? Should we go this route? How much of work was involved? What was your study? Like how many people did you target? So talk us through all of that.
Okay, so I think, yeah, it's been planning for a very long time. We start
I've just lost you this, Tasneem.
Assalamu alaikum. Are you able to hear me?
Okay, I can hear you now. So don't try not to move or anything. Just sit still, and hopefully it won't interrupt the it won't interrupt the feed.
Okay. So the project was in development for past 4 years now. It was part of my PhD project. What we have recognized, we've done extensive research, trying to figure out what is the need in the community is in terms of mental health, in terms of understanding something like depression, which is increasing globally, at alarming rates. Once we've done all of those research, we decided, the best way would be adapting something specifically for the South African context, that takes into account the unique symptoms experienced by South African individuals. Then we also looked at, fine, if we develop the screening tool and it's unique and it has South African, symptoms assessed, where would we put it? What platform are we going to use? And that's when we started doing research into, access. How much access do individuals have to mental health care? When we looked at that, we see mental health care access in South Africa is extremely limited. So we've decided to place it on an online platform, and this is a website. Website mainly because we see that, internet access in South Africa is increasing. We have just about 50% of individuals in South Africa that are able to use the internet through their mobile phones. So we've designed it to be used on a website compatible with a cell phone, a tablet, a laptop, in the comfort of an individual's home. In the comfort of an individual's home, why we've chosen that means, also because of the stigma attached to mental health. There's so much stigma in every community regarding mental health that individuals that do suffer or do have mental health issues, unfortunately, are not seeking their treatment because of the stigma. They know where to get treatment, but just going merely to, that doctor or that psychiatrist, that psychologist or counselor, for example, they know the stigma or the backlash they would get from their communities or family members. So it's designed that, they can take it in the comfort of their home and get an idea of what they're feeling. That's the key thing, is that individuals are unable to pinpoint what they're feeling and if it's depression or not. So the tool helps them understand what they are feeling. It's, 19 items that the individuals will screen themselves. And remember, it's just a screening tool. It's not a definite diagnosis. So individuals still would need to go to, the public hospital, to a GP, the psychologist to get a confirmed diagnosis, but it will give them the risk of depression from low risk, medium, or high risk. So they take the tool, they submit, and it will give them an instant feedback of their score, and also, who to contact. The minute I get the score, individuals would feel overwhelmed. So we've provided toll-free numbers where our counselors available that could assist them and just talk them through there and see how do they get intervention and treatment. I think the main reason we've designed it is to help break that stigma. In society, we see there's so much stigma around mental health, depression. COVID has highlighted, how people are suffering. People are really, is extremely debilitating having a mental illness. So we need to get individuals talking about it. We need to get them the first point of access, So this acts as a facilitation tool that they could use with their GP to say, listen, this is how I'm feeling, this is what I've done, and it shows my score at this point. And then their GP, psychologist, or psychiatrist can take it further in terms of treatment.
Okay, so what about the health professionals, counsel, or frontline health workers, a doctor or a psychologist? Let's assume I do the self-screening test at home, and it does suggest that I'm possibly suffering from low-grade depression, or it might be more severe. And I go to my doctor, my psychologist. Are they going to take me seriously enough in terms of, you've done this test at home? Are they not going to fob me off? Are they aware of this test? And how much of importance or relevance are they going to give to this test? I go to them with the test results and say, this is what the results are saying, I need help.
Okay, so in terms of that, I think, any practitioner would then reassess, they'll look at it, the results as a guide for them to further investigate and further assess the patient or the individual that is coming to their practice. The next step is what we've done. We've done quite a bit of stakeholder interviews, with doctors, with nurses, with psychologists, psychiatrists, just to find out if there's a need for this. Is there a genuine need for something like this in their practices? And it's indicated, all these practitioners have indicated that there is a need, and it will help them, facilitate that conversation and, have a bit more time to help with the treatment plan, because they would know what exactly, it would guide them in terms of what they are assessing. So I think in that way, we also are piloting and we're refining the tool, and we want to get buy-in from a lot of, practitioners to help us with this, because we can't do it alone. So, that's why we're putting it out there. We're testing it. We want to get feedback also from the practitioners. Is it useful? What needs to change? So that it may be something that they can use and capitalize on in terms of time they spend, because we know how limited resources are in terms of how many psychologists are they available to the community. For example, in South Africa, we see there's only one psychologist available to 100,000 individuals in the South African context. So, that's quite alarming. So something like this could help facilitate that conversation. And when we find individuals presenting at, local hospitals, public hospitals, their time is so short spent with a nurse or, a medical practitioner that in that time, they're unable to explain or convey what they're actually feeling. So this could help facilitate that conversation, and the practitioner could further investigate if it is, are they at high risk of depression, and what do we do in this instance? Or are they manifesting this way because of other medical conditions or medication that they are on?
Absolutely brilliant. So it's still in development phase, I should imagine. How soon will it be put out for use to the general public? And also, the other question is ethnicity, language issues. We do know that in South Africa, the majority of the people, English happens to be only your second language, your first language being an indigenous language. How are you working around that issue?
So firstly, in terms of when it would be out, we are currently in the second phase of testing again. So, we're looking at reaching a larger access, more vastness to see that we know, everything is fine on the tool, the items are okay, and we would refine it. In terms of releasing it, we hope sometime next year, that it could be early next year, inshallah, that it could be, distributed quite widely in the country. And remember, it's just for adults that would be using the screening tool. So we need a large and representative sample that we can test it on, to know that our tool is accurate. In terms of the ethnicity and also language, we've accounted for this in the screening tool. What we find is that the general population of South African majority are second language English speakers. So what we've done with the tool is we've adapted the items. So the questions that we ask are adapted in such a way that it's easily understood by an individual that has a literacy level of grade 5 or grade 4 English level. So they don't even have to be, at a high school level that they can understand it. Because, for example, if you ask somebody, I can't shake off the blues, they struggle to understand what does that idiom mean, So we've refined this, we've rephrased it in a way that it could be easily understood. And inshallah, further, there's room for development for this. We would like, to get it translated into various languages so you can the majority of the South African population can access it in their home language as well. So inshallah, I think with further development and, strength that we do have, we'll start to further develop and capitalize on all these other factors that needs to be considered.
And you don't think people will be reluctant to use this app? And I'm just thinking, we do know that there's a stigma against mental health issues. You don't think people will be kind of averse to using the app? Or do you think because they can do it in the privacy of their own home, that it is that, that they'd be more comforted in using it? And then also, what about affordability? So they do the test, they do this analysis, and they find, I presume, it will give some sort of a pop-up message saying, go and see a healthcare professional, or you are in low-grade depression, or whatever it is. They now need to get themselves to a healthcare professional. We know the situation of long queues at state hospitals and the issue around affordability. Is that not going to be off-putting? Or do you have a mechanism in place where they could get some sort of further free supportive assistance?
Yeah, so definitely the access, and that's a big concern for us. I think individuals would be likely to take the test because of the stigma, and it's in the comfort of their homes. They can take it when they want. And in terms of affordability of actually taking the screening tool, we've accounted for that. So our website that we currently are piloting is extremely low in terms of data that it is using. So we don't put that financial strain on the individual. And inshallah, we want to get this website zero rated, that anyone could go on and use it. They not necessarily have to have, data for them to access it. In terms of them getting their results, it's a PDF document that would come out. So they have the option of downloading and saving their document. And inshallah, we will be wanting to put in an email also. So they could email it to themselves or the practitioner. And, that is easily accessible for them. And they have the document with them on here. So they don't have to recall what their results were. In terms of where do they get help, we know how limited it is. And what we do have, we've provided details of 2 mental health counseling lines that are freely available in South Africa. So we charge nothing for the individual to call these lines, and they can assist them and give them guidance where to go on further. Unfortunately, at this point, we haven't gotten to that phase, of developing that ourselves. We do have these resources available. So we've highlighted these contact numbers in the feedback that individuals get to say, the South African Depression and Anxiety Group are doing great work in terms of counseling and also free services to the individual. So we've provided numbers like their helplines that the individual can seek immediate access and not be strained in terms of or constricted in terms of financial burden.
Wow, that's all I can say. Alhamdulillah, you seem to have covered all the bases. Once again, many congratulations to you and to Professor Sumaya Laher. You've truly done us very, very proud. And please give us a shout out when You're going to be launching the app so that we can give you some coverage here and make the greater public aware of the fact that it is now happening, inshallah.
Jazakallah khair for the airtime and for the exposure. We really do appreciate it.
My pleasure entirely. Do pass on my congratulations to Professor Laher as well. And undoubtedly, we will be talking again soon. Go well, keep us in your du'as, and salamu alaikum to you. That was Tasneem Hassem, research psychologist and sessional lecturer at Wits University, talking to us about the 1,000 rands in seed funding to develop a depression screening application for the South African context. And of course, she was working closely with Professor Sumaya Laher as well. And undoubtedly, these girls have truly done us very proud. We are now waiting, inshallah, for the app to be fully developed and launched into the country. So that brings us to the end of the show. Thank you indeed for your time on the program this morning. Hope you've enjoyed the interviews as much as we've enjoyed your company. And as always, please, even though we're in level 1, even though we are told that you can go and perform Umrah, the Holy Lands are going to accommodate full capacity crowds, and I think that seems to be the trend globally. I still believe we must not be complacent. Please follow the protocols, and that is mask up, social distancing, and hand washing, and of course, also take care on the roads. A big thank you to the producers, Milazi Boy, Zian Milazi Boy, and Nasreen Naidu. Till tomorrow at the same time as always. Assalamu alaikum and Khudafiz from me, Julie Ali.
Looking to get your kick? Kiki's have